I'm very proud of them. I'm very happy to have them all. I'm a mother with 5 children, and I love them all.
I'm 32 years old, so I've wanted to get pregnant. The timing, I wouldn't say we went out and said, we are going to get pregnant this right now. But I want very much to have a child now, and he does too. I just hope it's normal and loving and happy.
When we think of a pregnant woman, we think of, you know, the sweet, soft pictures of the woman taking care of herself and then nursing the baby. I mean, you don't think about someone who's living on the street, scrapping for money to get her drugs, maybe trading sex and prostituting for drugs. It's not a particularly nurturing maternal picture.
Alcohol along with cocaine. That has been a big one for me for a long time. And although I told myself I'm not going to be drinking, I'm pregnant, I can't be drinking. But somewhere in there, that little voice, that little addicted voice tells you you can have one. And so I said, okay, well, I think I'll have one drink. And before you know it, 3 or 4 beers later, you're going, Coke would wake me up from this, you know, just a little bit.
I just thank God that my child, Patrick, came out normal, that there was nothing wrong with him. He might have a little bit of problems because I was using heroin and cocaine and drinking.
You're making dinner, huh?
What do you make?
Dinner.
What kind of dinner?
When a pregnant woman uses alcohol or other drugs, developmental and physical problems can result for the baby.
So looking at the birth weight and looking at the growth rate and then looking at the facial features and then of course looking at developmental delay are the ways that we make the diagnosis of fetal alcohol syndrome.
I was too scared to go to the doctor because I was using at the time, and the time when I wanted to quit, I couldn't quit because the baby wanted it too.
Women using illegal drugs often do not receive prenatal care. Along with addiction, babies born to women using heroin or cocaine face an increased risk of neurological and other birth defects. But low birth weight is the single greatest threat to infant health. Using illegal drugs increases the risk of low birth weight 2 to 3 times, independent of any other factors, even use of tobacco or alcohol, even with prenatal care. And when women using illegal drugs don't receive prenatal care, the risk of low birth weight increases 6 to 9 times.
We're just really beginning to learn now about what some of the long-term effects of exposure to drugs is. Alcohol is really the only drug that we have very good long-term evidence. But what does seem to be coming up when we talk about other drugs like cocaine, heroin, marijuana, is that the family environment is crucial in the outcome. And that if the child gets the support that he or she needs, if the mother learns to work with the child to help him develop his skills, if they can form a good bond, if there can be some stability in the child's life, then the child can do very well.
I look back and I said, these days now, how I do my parenting with my kids, it was not the same one I was using. To me, you know, it's very important. They're very important to me now.
A high percentage of children of alcoholics grow up to be or to marry alcoholics. Without intervention, the cycle of alcohol and other drug abuse often repeats.
My mother was not, she wanted me, but she wasn't quite ready to take care of me because She was heavy into the drinking herself at that point. When she was pregnant with me, she said she had a pitcher of martinis at least a day.
The mother has to be willing to take care of herself. That a woman's ability to be a good parent, to really give her child what the child needs, is dependent upon her willingness to take care of her own needs. And so in order to really be helpful to her child, the woman has to be willing to address her own drug or alcohol problem and to get the kind of help that she needs.
Despite unhealthy early family experiences, parenting skills can be learned. Mothers may also benefit from counseling, job training, and educational guidance. Those services are available as part of a unique program called CAMI.
The objectives of this workshop are to define resiliency and what it means to be resilient, to explore ways of...
CAMI stands for Comprehensive Assistance to Mothers and Infants, and it's a program for pregnant women who are using drugs or are at risk for using drugs, and it's also for women who have children less than a year old who are at risk for using drugs. And what Project CAMI can do is to help women begin to take care of themselves. It can help them find a treatment program that works for them. It can help them begin to meet some of the social needs that they have to face, to find housing and food and social support. And it can also help them learn some of the important parenting skills that they'll need if their child is to grow and develop well.
Prenatally exposed infants often need extra care and support. The therapeutic nursery component of CAMI offers developmental and physical evaluation for children through their first year. Parents learn techniques for coping with special needs babies.
I really prefer to put the focus on the adult. Once the kid's got fetal alcohol syndrome, we'll deal with it. But we need to know what kind of interventions work with women. Treatment with women is very, very tricky because of our dual roles as people and mothers.
Residential treatment for pregnant and recently postpartum women is available at Kodak Behavioral Health Services Wildflowers residential program. Wildflowers opened its doors in 1991 and is one of only a few programs in the Southwest housing mothers and their infant children.
I had a lot of support in there, a lot of groups, and my therapist was very good because she's kind of helped me a lot, and a lot of people that Wildflowers that helped me a lot too. To me is that I had to do it for myself. That was just put there for me, but I had to do it. Nobody else was going to do it for me. And now me being clean and sober for 22 months, I feel great. I feel a new life. I feel brand new. And I want to do a lot of things now that I'm clean and sober. Even though that I'm 41 years old, I know I can still do it.